So why does anyone, much less a PhD in English, become a nurse? I will tell you why. I've shared many stories about myself, but this is one about a nurse I work with named Shannon. It's a Friday afternoon, and I got an admission from the outpatient cancer center across the street. The guy sounded very sick in the verbal report I heard, so I was surprised, happily surprised, to see how healthy he looked once he got to the floor. He had an infection we just couldn't clear, and he had it for about 2 months. He was sick of always feeling lousy, but he was stable, and his color and temperature were good. Change of shift was coming, and the transporter was bringing him back to the floor after a chest x-ray. I had just given a report to the night shift nurse coming on when I recognized him on a stretcher. I asked how things went in x-ray, and he said, as well as could be expected. And then he very seriously told me that he needed to talk to me. I said, okay, and walked with him back to his room. He told me he'd seen a nurse coming in for night shift, a nurse with curly hair and dark glasses. And then he asked me if that nurse was named Shannon. I said, yes. I couldn't tell how it was going to go. He was so serious and intense. Was he going to lodge a complaint about a bad experience? And then he told me the story. 3 years ago, he'd come in for treatment with a drug that we call a monoclonal antibody. It's what we call a hard drug because it can make patients confused, slow down their kidney function to almost nothing, and give them dangerously low blood pressure. The drug had a deleterious enough effect that the patient ended up being transferred to the ICU. While he waited for that transfer, Shannon stayed with them. Then the next morning, when she was done with night shift, Shannon visited him in the ICU before she went home. Her caring and her presence had a huge impact on him. He worked near the park where she went for runs, and he used to look for her on the running trails. He'd come back to the floor one day specifically to thank her, but she wasn't there. As he talked, I got chills. This, I realized, was the heart of nursing. Even though Shannon was a new nurse at that time, she knew what his treatment could do to him and how to help him. These events took place more than 3 years ago, but the patient still remembered Shannon and what a difference she made. Every day and every night in hospitals across the country, nurses are making a difference the same way Shannon did. Not doctors, but nurses. Now, I'm not one of those nurses who puts down physicians or believes that nurses are just as good as doctors. Doctors are good at being doctors, and we're good at being nurses. Very different roles, and I don't find it helpful to elevate one at the expense of the other. But we can still focus on why the nurse was so important to this particular patient. First, Shannon served as the canary in the coal mine regarding this patient's response to his treatment. The drug requires careful monitoring, and she obviously stayed on top of that. Second, she was there to figuratively, but also literally, hold the patient's hand. Physicians do a lot of things, but they rarely monitor or comfort patients at the bedside for the long stretches of time that nurses do. Watching, waiting, intuiting, acting over the course of a shift. That's what floor nurses do, because we are right there by the patient. Knowing you made a difference in someone's life when they felt sick and alone is, for me, the best kind of job satisfaction going. It's what drew me to nursing and what keeps me on the floor, despite how aggravating and draining the job itself can be. But the whys continue, and in fact intensified around the time that Critical Care was published. People at My least favorite comment of all was and is, "You're still working as a nurse? Well, you get a lot of good material from your job, right?" On the one hand, of course, I get a lot of good material because I write about nursing. But on the other hand, how cynical can you get? Nurses have said this to me while I'm at work, and I always want to answer back, what does it look like I'm doing here? But instead, I give a softer answer reflective of my commitment to nursing. I say that I do actually like my job. The best line I ever got about why anyone becomes a nurse is worth repeating over and over again, and it came from Claire Fagan. Claire was the dean of the School of Nursing at UPenn from I wrote down the wrong dates, for a long, worthy time. And also served as interim president of Penn from June 1993 to 94. She was the first woman appointed interim president of an Ivy League university. I'm lucky enough to know Claire, and I was complaining to her about all these whys. Her response was elegant in its simplicity and striking for its sincerity. She told me that when people ask why I'm a nurse, the only possible answer is because that's who I am. I want everyone here to take away this message tonight. We choose to work as nurses because that's who we are. But we also want to keep working as nurses and to encourage talented and caring men and women to enter the profession and stay in it. So the other message I want each of you to take away tonight is that being a nurse should not mean settling for less. Patients come to the hospital because they need the care of nurses, and without nurses, hospitals would not function, or at least they would not function well. For too long, we nurses have given this fact very little credence. We have failed to realize just how many of us there are, 3 million, and what a difference it would make if we banded together to demand working conditions that allowed us to care for patients in the way we would really like to. As a writer about nursing, I've always understood my mission as educating the public about what nurses really do. Every nurse in this room has the ability to continue that work on her or his own. It doesn't mean you have to blog, write a book, or write at all. It means you have to tell the true story of the job you do. It means speaking up when conditions on the floor are unsafe or unfair. It means bonding with the nurses on your floor, not doing what makes your manager happy, or letting off steam by sniping at other nurses behind their backs. It means working collaboratively with doctors, even when some of them will view your assertiveness as a challenge and try that much harder to shoot you down. Why did I become a nurse? Because that's who I am. Why did each of you become nurses? Look in your heart, find the answer, and go from there.